Sagar, just wait for a while. We'll just begin in like 2-3 minutes. Okay. Sagar, well, my usual class timings are at 11. And you should have confirmed from the authorities here, maybe. Never mind. Feel free to attend the class from home. Today it's raining although. So better stay at home maybe. As of now, Monday and Saturday, 11 a.m. Okay. So, like in last class, we completed the relation of anthropology with certain social sciences such as political science, sociology, economics, okay, and history. Then we proceeded forward to behavioral science, which is psychology. So in total, we have done 5 or 6, okay, and social work also. Today, we will be more focusing upon the disciplines which are more based on scientific laws, based on premises of natural sciences such as geology, life sciences, forensic science, environmental science, okay, all of them. So in all, they are 5. So today the disciplines we will be covering with relation to anthropology are, first is your forensic science, second is life science, third is medical science, fourth your geological or earth sciences, where we have geology to deal with, and fifth will be your environmental science. Okay, so these 5. Among these 5, forensics, medical, geological, are important from examination point of view. Although all of them are important, but these three have a special focus due to the subject nature they have, the kind of scope they have, the kind of relevance they have with anthropology. So these three are important, and these especially your geological and earth sciences, it has been there with anthropology since the beginning. Forensic, it is relatively a new development in the field, but the association, it goes back till early 1900s, but after 1970s, more profound professionalism has been established. Life sciences, as we know, more or less studying the living beings in its, especially in their biological totality. Medical science and environmental science in the end, the interaction of man and his surroundings basically. Okay, so today we'll begin with forensics first and then gradually move ahead to all these. Now, relationship of anthropology with forensic science. So you see, the discipline of forensic science, it basically involves, what does it involve? Anyone? What does the discipline of forensic science involves? What is the aim of the discipline of forensic science? You have seen CID, Adalat. No. There is a specific term for that. Just focus on that. What does forensic science basically tries to do? In what field basically it is more applied? Crime, obviously what? To solve criminal cases, to perform criminal investigations, all of that with proofs which are basically standardized in nature. There are certain methods, there are certain standards which has been established by medical sciences which they follow. Okay, so the basic aim is about solving certain criminal cases. So the application is more in terms of medico-judicial purposes. Okay, medico-judicial purposes. Okay, so that is the major aim. And from anthropology, which branch we will nominate for relation with forensic science? Physical anthropology. We can also nominate archaeology, but it is the physical anthropologists who are more closely associated with forensic science, and there is a branch called what? Forensic anthropology, where physical anthropologists who are well trained in forensic methods, they supplement criminal investigations, they supplement certain cases, with the methods which has been established and by the procedures these people have for them. We'll discuss them. Okay, so major aim is to identify skeletal remains. The major aim is to identify the skeletal remains which has been left out at the criminal sites, or which are unidentified basically. So within anthropology we have certain methods through anthropometry. Okay, identify skeletal. So let me give you an example. During World War II and Korean War, there were so many US soldiers who died, and their remains were not be able to identify at the place where they died. So all their remains, the skeletons, they were brought to the US Army Air Base, and then with the help of forensic anthropologists, the remains, they were identified, they were classified like to which population group they belong to, what is the age of that individual. So that's how, that's a practical application of the field. Okay. Similarly, the discipline, both of them, forensic science and anthropology, they work towards estimation of age. Estimation of age. How do we do that? Anyone? No, we are not using carbon dating here. How do we do age estimation in forensic science? Bones, okay. So you estimate age through bones, sutures in the skull. How do you estimate age through bones? Through the fusion process. Bones, they fuse together with each other. So you see, normally we say that we have (29) cranial and 177 postcranial bones. So this is for the normal individual, but in children there are more than that because the bones have not been fused yet. Okay, that is the case. So when, especially after, it becomes a bit difficult after 30 years of age, because till 30 years of age, more or less your bones are, they are fused all about. So it is easier also after 30 years of age that yes, you can clearly identify if the bones has been fused. That means the individual is beyond 30 years of age, 25, 30 years of age. Similarly, the case of sutures in the skull, there are lines, suppose this is a human skull. So you will find lines like this. Have you seen sutures kind of? There are certain lines in the skull, if you see that. So there are sutures. They also fuse with age. So based on the fusion of certain sutures, you can identify what is the age of the individual. Okay. Then through what can be a third? Dentition. So for a child, it is easy to identify, to get identified. But if someone is an adult, that means we use the fourth molar as the criteria to identify whether it is an adult or whether it is a child. So dentition also helps us in identifying or estimation of age. What else can be used for age estimation? Basically, these three are important. Then, after estimation of age, you estimate the sex of individual. And how do we perform sex estimation? That to which sex the individual belong to? For example, the pelvis bone, your pelvis bone basically, or the pelvic bone, based on the estimates, if you can clearly identify or you can recognize, it gives around 80 to 90% of surety that it belongs to male or female, because the females, they have a broader pelvis, broader pelvic girdle, this area, whereas male, they have a narrow one compared to the females. So based on that, you can identify that yes, it belongs to a male or a female. So you can identify the sex of an individual. Also the bones, the structure of bones, they vary between men and women. Males, they have more solid, more calcified and thicker bones compared to the females. Okay, in that sense. But that can also lead to some kind of disassociation, or also diversion from exact point, because the kind of role pelvis can perform, other bones, they do not give that higher estimates. They are around 40%, 30%. Okay, similar to that also. So you estimate sex basically from pelvic bone and other bones of the body, and also from the skull. Okay, also skull is also used. This is the second thing they do in combination with forensic scientists. Okay. Have you heard of the word sexual dimorphism? That is the thing. Jawline, the roundness of skull, sagittal crest, all of that. So Basically, when we talk about relation of these disciplines, what we are trying to do is we are trying to, trying to apply the sexual dimorphism in reality on criminal cases. So for anyone who knows what sexual dimorphism is? You have heard that word, right? Sexual dimorphism. Anyone who has not heard? You have heard it? Not you? Sexual dimorphism. Anyone out there, if someone has heard the word sexual dimorphism? You normally study the characters of primates, right? And within that you study that the humans, they have this this process of sexual dimorphism to differentiate between man and woman. Take a clue from that. Forensics is all about clue. There is a difference between both. Dimorphism means difference. That is very simple aspect, that how you female body. Yes. So when we talk of dimorphism, we basically talk in terms of the structural similarities, dissimilarities which are present in the male and female body. It's not just about skeleton, it's about the complete female and male body with respect to their skeleton also, muscular system also, as well as the characteristics which are phenotypically expressed. Okay, all of that. So where are we? We were at sex estimation. Then see, this is just about bones. How many bones are there? So when you identify the age of an individual, you can identify that from the bones also, because when we talk about the cranial bones, we have some sutures in the brain, on the skull. The fusion of those sutures, they tell us that what can be the age of an individual. There are different sutures who fuse at different intervals of age. Okay, so you can identify what can be the estimated age of the individual. The other bones which are there, if you see in a normal individual, we have 177 postcranial bones apart from the skull. In a child, there are more than that because the bones have not completely fused. So your metacarpals, all of them, they can be really helpful to identify whether the bones belong to a child or an adult. Okay, so based on the fusion, you can identify whether they belong to certain individual, whether it is a male or a female. The structure of bones, whether they are more calcified, more solid in nature. Okay, all of that. Third is you can identify the race and ancestry, because in physical anthropology we do what we say is racial classifications, and based in racial classifications we have different criteria which are genetic as well as morphological in nature. So when we talk about identifying race, we, for example, just take case of these nasal openings. Take case of nasal openings. Okay, so you found a grave, you found you found certain skeletons lying in a cave, and you need to identify that, okay, to which races they belong to. We have complete skeletons, and we'll first look at the nasal openings, for example. So within the Caucasian population, these nasal openings, they will be triangular in nature. Okay, no need to exactly write it about, just for illustration. They will be triangular in nature. Within a negroid, they will be square, the nasal openings, and within the mongoloid, where has it gone? What happened to it? Okay. It's square in them, and among the mongoloid, they are more diamond shaped. Okay, diamond shaped in nature. So you can clearly identify that, yes, based on the based on the natural openings that to which race or ethnic group then individual belonged to. Okay. Caucasian कौन होते हैं? Europeans, Americans, the white skin, basically all of them. Okay. Stay near the. No, that's not. See, Americans do not stay near the Caucasian.
That they started calling them.
No, that is not the case. See, these classifications by Houghton, these are Houghton's classification, na? J.H. Houghton's classification. So based on certain morphological criteria like hair form, this epicanthic fold, like the Mongoloids, they have an epicanthic fold in their eyes, based on height, based on these what we call as this skin color. Through all of that, they classified races basically based on more morphological criteria. They have classified races according to that scale. Okay. You can also identify whether an individual was left hand dominated or right hand dominated based on the strength of bones. If a complete skeleton is there or whether an individual with muscles is also there, you can identify through the joints of muscle with the bones that they are very strengthened in their nature compared to the non-dominant hand. So you can identify whether individual left-handed or a right-handed individual. Okay, so you can also do that with that. You can estimate height. Height estimation can be performed with the help of bones. Suppose, for example, through femur, you can identify femur, which is the longest bone in the body. Through its measurement, you can identify the height of an individual because there is a scale of measurement which is provided by this forensic science basically, and based on that scale we categorize. Okay, for example, suppose the length of femur is 60 centimeter. So you can identify that individuals who have normally 60 centimeter of femur length, they may be of 150 to 160 centimeter of height. So you get an estimation, because in forensics there is no accuracy, it's all about estimation. Okay, so it's all about estimation only. The underlying principle of forensic science is estimation. You cannot be 100% accurate that this is what has happened. No, you can only recreate the framework, you can recreate the crime scene, but you cannot be certainly sure that actually that happened or not. So it's more about estimation, which yes, it's more about estimation in the end. Then you have I told you, yes, okay, broader pelvis, brow ridge, sutures, joints, skulls, okay. And also we study blood types, your palm patterns, okay, all of them. Basically the dermatographics part. Dermatographics means study of your palm and fingerprint patterns, all of that. So the ultimate aim is to
Study fingerprint.
See,
It's such a unique feature.
you can study fingerprints pattern. That's why. So what happens in forensic science is that you have to identify that unique individual, na? So there is this chemical. There is this chemical which you apply on your hand. It's black in color. There is a sheet on which you place your hand like that. Both of your hands you place like that, and there are certain ridge patterns which emerges out. There are ridge on your ridges. There are three kinds of pattern basically on your fingers. So based on those patterns, you identify whether that individual belong to which part or so. This dermatographics is also one of the part of racial classification.
Which is the bone structure of the entire. It's really impossible.
See, what I'm telling you is that you just need not to have the fingerprints. To identify an individual, what do you have to know? His age, height, sex, three things you already have. Some kind of DNA will also be there. But that when we talk about DNA, Jefferson calls it as the, Jefferson says that it is the gold standard. Okay, it is the gold standard. DNA analysis for human remains, it is the gold standard, that it gives the best accuracy to identify. But for crime scenes, from crime spots, it is more amenable to contamination, because the kind of crime scene you are going to, it is, the way you have to carry it, it gets destroyed in between if you do not have proper storage facilities for that. Okay, all of that. That is why we normally rely upon this pelvis identification and all. Okay, based on that for identity. So there are so many of them through which you can identify. It is not just you have to rely on fingerprint patterns only. So you can identify based on so many things. That is because what I was saying, we are talking about estimation only. And when you are doing this analysis, there are two things. There are pre-mortem period and post-mortem period. That means this ante-mortem and post-mortem period. Okay, both of those times they have a different kind of bodily structures at present of time. If there are acidic soils, that means the body will decompose quickly. If there are more alkaline soils, the body will more or less remain in a state of, it will more or less remain intact. If it is cold, it will also remain intact. Okay, the kind of insects, the kind of microorganisms which are present, through which are present, with help of those also you can identify that yes, there are two things: time of death you identify, and second is time since death. No, these are the things which we do on the remains which we found. We are not just talking about skeletal remains, we are also talking about proper human body remains, because the ultimate aim is to investigate and create the identity of the individual. Okay, so we also do time of death and time since death. Means, can anyone tell the difference, time of death and time since death? How long it has been the person died. Okay, so to identify time since death, we also take help of the insects which are present there, flesh eating insects, the microorganisms which are there, entomology, rigor mortis and all, vigor mortis, all of them. Okay, the rigidness of the body, it increases with time. Okay, whether it has been 72 hours, 36 hours. So based on that complete set, we get to identify about them. Okay, then we also study the trauma patterns. Trauma means the kind of injury that person has sustained, or the kind of injury that person has been given. Okay, by analyzing the bones, you can clearly identify that whether it was someone was hit, it was hit by certain blade, certain thin structure or a thick structure, whether it was knife, something kind of that, because the kind of impact it will have on the bone structure, it will clearly let you know. Okay, the blow, the kind of force which has been used upon that individual, you can identify through that. So you can also identify the trauma in that. Okay, then next you do is facial reconstruction. Next they do is facial reconstruction. So when nothing is working at times, you need to reconstruct the face of the individual. So through the jaw bones, the eye sockets you have, what you do is, initially there were using rubber and wax, all of that, a face was used to construct it and estimate like how might the individual look like. Suppose he belonged to Negroid race, he belonged to a population which is black. So for that you see that it has square nasal openings. So you can clearly say that it might have woolly hairs, the frizzly hairs like this, hairs like this. So through all of that, the eye pattern he have, for example, someone found in Northeast or in China, he will have epicanthic fold in his eyes. The eyes will be smaller in nature. There will be an epicanthic fold in those. So you can clearly recognize that person. The skin of the color will be more or less a yellowish shade in nature. The stature will be short. Okay, so the face, it will be flat. So you will reconstruct that. Initially we used to do with hands in laboratories, but now there are softwares like CARES, through the help of which we do facial reconstruction. So you see, how many methods do we have to identify an individual? There are so many methods of them, ranging from DNA, height estimation, age estimation, the kind of injury that individual has sustained, trauma. So based on all of that, time since death, time of death, based on all of that, you create a crime scene. You create a crime scene, you create an identity of an individual. Okay, but the issue here lies is that with physical anthropology, they are only employed to supplement the investigation. Their verdict is not final, it is not judgmental in nature. You cannot say that this is what has happened. You can only give them an estimate that what has happened in the past. Okay, how the individual sustained those injuries and all. So role is more in criminal investigations. Okay, role is more in criminal investigations, and it basically started with Locard's principle. What is Locard's principle? Anyone? That's homework for you. It's very easy. The moment you will read it, you will apply in your everyday life. Okay. Okay. So, and after 1970, especially 1972, forensic anthropology as a branch was given recognition by American Anthropological Association and forensic associations in US. And with time, they have been really helpful in identifying certain, these mass scale graves which were there, certain homicide patterns which were there. So they are more or less used in those cases which are more related to these genocides, homicide, culpicide, all of that, because physical anthropologists they have a wider biological understanding of the body compared to forensic anthropologists. The methods they use, although forensics have their own methods and theories, but the methods and the standards which are used by physical anthropologists through anthropometry, they are more refined in nature. The kind of measurements they can take, the kind of estimation they provide using these gold standards of measurements. So they help forensic sciences in their case. Okay, so that is about how forensic science are associated with this physical anthropology. Okay. Facial reconstruction we have done, acidic soil. Yes, so this is more or less about forensics in that case. So both of these disciplines, they help each other basically in criminal investigations, reconstruction of identities, and they do that through age estimation, height estimation, sex estimation, ancestry estimation, race estimation, facial recognition. Okay, all of that. They use methods of DNA analysis to identify to which population or to which group the individual belong to. And yes, I believe more or less that is the case, and I'll give you an example of US Army, that how they took help of forensic anthropologists in identifying the remains of the soldiers who fought in World War II and the Korean War. Okay, they were not being able to identify it. So yes, this is more or less in that. We need to not dwell more into that, because in applications of applied anthropology, there is a separate chapter on physical anthropology. So maybe all of them. And also you can include about bone analysis, because in anthropology what we do is when we are discussing the scope of physical anthropology, there was a subdomain called human osteology and skeletal biology. So in that we study the patterns of bone, the structure of bones, their association with different kind of bones, how they fuse at different points of time. So when we do bone analysis here, what do we do is, especially during the time of trauma, we can identify that suppose an individual was burnt. How you will identify that at what temperature that individual was burnt? By seeing the color of bone. By seeing the color of bone, you can identify that at what temperature that individual was burnt. So Obesker's classification is there. I guess that is a 4-5 field classification of Obesker's. where when higher the temperature, darker the color of the bone. Because in the end it will, but in the end, what is the ultimate color which when the ash comes into from? It's more grayish in nature. So the bone, it gives out different colors: yellow, light, pinkish also, grayish color, brownish color, okay, reddish color in nature, all of that, black color, all of that. So based on that chronology, based on the based on that classification, you can identify that what was the temperature at which then individual was exposed to different kind of fires or burnt that. Okay, so that is also one case in which they use that. So this was about forensics. More or less it is about CID, okay, but not that CID. They do not take forensic anthropologists. Here we have more refined individuals who are actually working in labs, who are going out in fields, recreating the crime scenes, okay, and helping out the judicial processes, criminal investigations. Okay, so both the especially due to the specialty of physical anthropology in genetics, in human osteology, in bone measurements, bodily measurements, they are associated with forensic science. Okay, that is one case. Now let's move to life sciences. Has anybody seen Bones? There is this Bones. It's more or less physical anthropology and forensic science in combination. That web series Bones. I've also not seen, but I know. Okay, it's a good series as well as I have heard about it, but there are also certain lacunas in that. Okay. So life sciences is what it is basically concerned with. So sir, we have two aspects in relation, physical and biological. Yes, exactly, Sagar. So we have two aspects, both physical and biological, without any doubt. It is not just we are dealing with skeletal remains, we are also dealing with complete body remains or partial body remains. Okay, so we can identify all of that through physical and biological systems, so definitely. So anyone, what is life sciences all about? There is a course, BSc Life Science. Heard of it? BSc Life Sciences and Physical Science. Who do not get into honors, they take life sciences and physical sciences. That is their common perception basically. Anyone from life science or sciences background? No one from science background apart from you? That is all. That is a professional science. That is science. No one else from. But you have heard this word, right? Life sciences. There are companies which add life sciences at their ends. Exactly. So it is the biological study of living organisms. Biological study of living organisms. And how do we study the living organisms biologically? Through two branches, zoology and botany. Simple. In one we study plants, in other we study animals. We are a part of zoology. The remaining are. Huh? No. What I am saying, biological study of living organisms. So how do you study those living organisms? Through biology, so zoology and botany. These are branches of biology, no doubt. But life sciences, it is not just about biology, it is about your medical sciences also. Everything which is living is concerned with life sciences. Whereas in anthropology, everything which is human is anthropological in nature. Everything which is living is life sciences in nature. So biology is a part of it. Medical sciences is a part of it. Your ecology is a part of it. Anthropology is a part of it. Anthropology, for some it is a science, for some it is an art, for some it is humanities, for some it is social sciences. Some people do BA in anthropology, some do BSc in anthropology. Okay, it is more about how you approach a particular phenomena in anthropology that decides whether it is a science or an art. Okay, that is one case. Whatever you study, the life processes of the individual, the way they grow, the way they die, their association with their external and internal environment, that's all what comes under your life sciences part. Okay, and anthropology is also more or less a part of it, but the difference here is, in anthropology we are not just concerned with the biological part, we are also concerned with the sociological part or cultural part. We are concerned with that, but that is not the case with life sciences. So we have, although life sciences do a biological study of all that, but we are more focused on a holistic study of mankind. So our scope gets restricted to more or less to human beings, whereas in life sciences you have so many branches just like anthropology. Just name few branches in life sciences. Tell me few branches in life sciences. Name of those branches. Anyone? Any, like whatever you study in life sciences. Molecular biology, you study biotechnology, molecular biology, immunology, and biomechanics of the body, physiology, anatomy. What else? There are so many. That's classification, coordinates, non-coordinates. Okay. What do you study in life sciences? Anyone? Everyone will tell one. Yes, start from you. What do we study in life sciences? Huh? Biotech, anatomy, molecular, CS2. What? Genetics. Of which body? Living body, basically. Biotech, biotherms. Okay. Virology, okay, viruses. Anatomy of? Anyone has told anatomy? Yes, like something new. Physiology, evolution, genetics, nanotech. Okay. Application of nanotech in life sciences. Ecology, adaptation, everything. Whatever is concerned with living beings, we study in life sciences. Classifications, exactly. Okay. In anthropology, we are more concerned with, especially in physical anthropology, we are more concerned with the emergence of human beings, their adaptation to local environment, their genetics, the change in genetic structures. Okay. So overall, our main concern is about the structure, organization, and evolution of human beings as a biological species. And from life sciences, given the broad scope it has in itself, especially in terms of its genetic research, especially in terms of its interdisciplinary nature, physical anthropology can collaborate with life sciences for enhancing the understanding of human being as a biological agent or a biological being. Because in life sciences you will find that more focused within zoology and botany is upon plants, animal species, but anthropology is more specified to human beings only. Okay, take case of, although when we study virology, we study viruses, mycology about fungi, algae, all of that. Okay, but the kind of disciplinary structure anthropology provides, it is more or less absent in other disciplines of life sciences, except for ecology and anatomy. So when you are studying anatomy, when you are studying physiology in life sciences, will they not help physical anthropology? The moment you are evolving the nature of a discipline, for example, recently there was this case where a pig's heart was transplanted into a human being a few months back. I guess it was a case of February or so. I think that individual died recently. He died. So did that not enhance our understanding that how tissues and organs after transplantation they react with each other? Was it not the human body on which that experiment was conducted? It was an experiment in the end. Now we can say that you are transplanting a pig's heart into human just because it has certain functional affinities to human heart. Cloning, take the case, which is a very ethical issue. It enhances understanding about interaction of genes with the environment or within the body, how the molecular functioning works. So we can take assistance from life sciences to understand that how our own body, it adapts to different circumstances, and also we can contribute to life sciences that how human body it adapts to different external as well as internal pressures. Okay, that's one thing. And all those fundamentals of evolution, growth, to study growth we need to have growth patterns, growth methodologies, all of that. Every living being has their own pattern of growth. In humans we have our own patterns of growth, evolutionary patterns. You can connect the evolutionary patterns of humans with other species, with life sciences, all of that. You can trace down the phylogenetic status of different species which are related to humans. Biolanguage, if you talk about that, how language as a biological phenomena has been, it has been introduced into human forms. So the scope is very wide. Given the number of sub-disciplines life sciences has, it can definitely assist anthropology, and anthropology vice versa can help it out in understanding the complexity of biological beings. And in the end, what is the ultimate of human physical anthropology? To understand the human being as a biological entity. And what does that comprise? Is your anatomy, physiology, morphology, evolution, growth, disease patterns, everything. So you have everything into that. So that's how both of the disciplines are related to each other. A very simple example, another, DNA extraction and studies, DNA profilings, all of that. So the more they are evolving, the more they are helping each other. Okay, so that is more about that case. Classification and all we have told, like with coming of especially in 16th, 17th and 18th century, there were so many development in the field of biology, such as when William Harvey discovered the blood circulation process. Then what do we have? Anything else? What happened in 16th, 17th, 18th century? Carlos Linnaeus's classification came out. Okay, how he classified different, how he classified the complete living organisms into different. That came later in 1900s, especially during 17th and 18th century. Okay, there were a renewed interest in surgical processes into the body. Apes, Tyson, he dissected apes to assess how they resemble human anatomy. Okay, there were certain discoveries of new medical instruments which came forward, which any instrument which came around 16th, 17th, 18th century. Electrical microscope, simple microscope maybe. So all these helped. Anthropology came at a later date, but life sciences has been there. Life sciences as a discipline has been there with contribution from different individuals who have lived across time. Hippocrates, all of them. You have heard of Hippocrates? The Hippocratic Oath, father of medicine. Okay, that was ancient times. Coming in newer times, I already told you there was Tyson, there was William Harvey, all of these people who have enhanced our understanding. Carlos Linnaeus, Darwin, all of these people, they helped in enhancing our understanding. Mendel and his genetic laws, all they contributed in the field of life sciences basically, and we are borrowing it from there due to the interdisciplinary nature of the discipline. Physical anthropology is a discipline in itself. Just because it is focusing on human, it differentiates itself from life sciences and other disciplines. Had anthropology not been a different discipline, we could have placed human biology, human osteology within zoology itself. As simple as that. But due to the fact that anthropology emerged as a different discipline, we now have to relate with life sciences as a different segment. Okay, that is what it is about. Biotechnology, take another example, how it is helping us. There are these cases of nowadays to replace faulty genes in the body. How do you do that? Through biotech. Okay, you are replacing faulty genes in the body, which suppose these faulty genes are basically the lethal genes, which will what they will do? They will reduce the chance of your survival. There are so many genes which are inherited in the generations. Okay, so you replace them with more functional genes, which can be, yeah, the genetic diseases, they are being targeted through these patterns. Okay, these things are happening into that case. Another example of biotech use with anthropology can be, anyone? The Human Genome Project. A very simple example, Human Genome Project. Started in 90s, ended in early 2000s. Northern blotting techniques, southern blotting techniques for AIDS identification, all of that comes in medical science basically. We'll deal with that. That's in medical science. So medical science is a different discipline here. Life and medical. Medical is more focused upon more anatomical systems, disease patterns, growth, all of that. Here we have a more refined understanding about the biological functioning of the living organisms. Okay. So, yes, cell biology is also hematology, study of blood. Okay, that's also a part into that. We study different disease of blood, how it helps in adaptation to different processes, especially at high altitudes. Okay, all of that. Drug delivery, yes, for drug discovery also we use biotech, exactly. Nanotech, yes. Recently you might have heard that how these the Neuralink, that how Elon Musk and all are trying to insert some chip into the brain. Have heard of that? Yes, all of that. So what they are trying to basically do? Increase the human efficiency. So will they test directly it onto the humans? No, they will be taking certain model animals, certain rats who have close affinities with the human functional systems. Pigs, for example. Okay, all of that. Life expectancy increasing, drug discoveries, which we do in this, there's this discipline of, along with biopharmacology, and one is, no, there is one discipline, I forget his name, where we, biochemistry is one, but for drug delivery discovery there is specific one discipline. I've read that discipline, yeah, I just in graduation. I keep on forgetting certain. There are so many subjects I have studied that I do not remember that what are they. So for drug discovery there is this let it be. Okay, let's move ahead to the next one. Now we will deal with medical science. I think today's class is going to be very short because there are 4 or 5 very small. After medical we have earth and environmental science. Half of. Who told you it was at 12? No, for me it is 11, Mondays and Saturday as of now. Classes will be at 11 AM only. Okay. So if someone tells you at 11 or 12, so ask them to shift to 11. Okay. So it's 12. Yes, Sagar was telling me that we thought it as at 12. Okay, all of that. So what we have in medical sciences, anyone? What do we study in medical sciences? Anyone? These are things which you come across every day. Medical science, life science, this science, that science. Think. So for Ananya, it's notes. Medical science is about notes for Ananya. Ananya, first tell me, what do we study in medical sciences? Medicine. Which medicine? Homeopathic medicine. Generic medicines. Ayush stores.
Your anatomy of living beings and human beings.
Are human beings not living beings?
Entirely or just specified to you?
What are we dealing with basically?
Study of anatomy.
No. In this topic, what are we dealing with? Relationship of anthropology with medical sciences. That means we are dealing with humans. We are dealing with humans here. Sir, life sciences do not cover disease and disorders. Do they? Do we study disorders and diseases in life science? Anyone? We do study genetic diseases in that, genetic disorders in that. Why not? But your everyday physiological dysfunctioning is more confined to medical sciences. We do study in life sciences certain molecular disorders, certain genetic disorders which are inherited through pedigree analysis, all of that. Okay. Sir, medical science and covered disease and it definitely covered disorder and diseases for sure. Okay. So basically in medical science, we go to okay. So with anthropology, it has a trans and interdisciplinary relationship. Medical science, the application of knowledge obtained from life science. Okay. Mukul is saying medical science deal with living organism. Okay. Taj is saying that. Mukul is saying application of knowledge obtained from life science. So more or less, we are getting diverse views that what medical science is all about. Yes, we do apply knowledge from life sciences into medical sciences without any doubt. Then only we will be able to exactly study the physiological anatomical systems of human body, the disease patterns. Okay, then only we will be able to identify that. So physical anthropology, the biggest contribution it makes to medical sciences is the study of disorders which are more genetic in nature. Okay, which are more genetic in nature, supplemented by your other disorders or other diseases. It has, it is a basic perception that the doctors, their genetic part is not that good. You go and ask a doctor about genetics, he will not have much to say about it. You ask him about fever and all, he will just give you a in writing he will give you things which you can even not understand. Okay, so what does the doctor writes on those prescriptions? Anyone? Is it the name of medicine or the salt? It is salt. Yes, so it's more about the salt. They write that, okay, take this salt. So basically it's more about bringing the body back into harmony. Okay, so the biggest contribution is about that how certain genetic and other diseases are spread, how they emerge, how they impact different population groups across different regions of the world, whether a particular disease is epidemic, it is endemic in nature. Give a recent example of a epidemic and endemic disease? Monkeypox is endemic basically. So monkeypox, where does it emerge? Africa during 1950s, 60s, around that point of 50s, 60s. And where was the first case identified in India? Kerala. Okay. So, and when we come talk of genetic disorders, there are so many like Huntington chorea, Parkinson's, okay, Down syndrome, Cry-to-Chat syndrome. Any more genetic disorders you know? Klinefelters. Any more? Genetic disorder? Sickle cell? Is it genetic? Thalassemia? Okay. So, within anthropology, especially within medical anthropology, yes, especially in medical anthropology, we study the cultural base, we study the socio-medical base of a particular disorder, of the existence of a particular medicinal system through systems like ethnomedicine, all of that. So to combine medical sciences with anthropology, we have medical anthropology as the mediator in between, which helps us in knowing the the causation of different diseases. And this causation is not basically about physiological dysfunctioning, it is coming from a cultural perspective, that what people think how the disease can be cured. Systems of ethnomedicines, because you see there are so many countries where there are multiple systems of medicine which are in place. In India we have so many. For example, name 4 medical systems in India. Unani, Ayurveda, all of that. There are medical systems. Similarly, but these are well recognized. Before recognition, before establishment of Ayush Ministry and all, in Africa, China, what people used to do is, despite of going to the doctor, they will definitely refer, they will go and they will refer themselves to a traditional, what we say, Hakim, Ved, all of those people, they have different names for them. They will not trust the doctors as such, because it is not something which they have been culturally trained about. So they will go more towards these local quacks, more towards these shamans who are there, traditional healers who are there. So an alternative system of medicine, alternative medicine systems, AMS, they exist. And due to existence of these alternative medical systems, it was found that people, they are not more relying on the Western biomedicine, because the ultimate aim of Western biomedicine is to, is not to cure individual, is to relieve him from the pain. Have you seen someone getting completely cured from a medicine? It is more of like you go to a doctor for a heart consultation and see the number of tests he will give you. But go to a traditional healer, he will say, okay, go there and drink that, eat that, you will be fine in a few days. So from a problem oriented approach to a solution oriented approach, every system have their own rationality behind that, because across the world you see Western biomedicine system, it has been used for treating certain diseases which these traditions cannot even think about curing, because they are more based on authorities of the individual, which are in genetic, this generationally passed, they are being trained into those things. Okay, all of that. When these things came into recognition that people are not approaching Western biomedicine and they are not eating it, throwing it into dustbin, more focusing upon these alternative medical systems. So the governments in Africa and China, what they did is they amalgamated these systems into the medical systems of the country.
That's what WHO said about India, that India
Yes.
will be the center of this type.
Exactly. So that people will have more faith they will have more confidence on the system. It will up to them which system they want to, which system they want to go with. But with coming of these systems in tandem, what has helped is that anthropology has helped medical sciences by making that understand that there are certain cultural values which are associated with people, and you need to identify those values. Go to a doctor and you will find that there is a very big power difference between you and the doctor, between the patient and the doctor. You yourself experience that thing, that there is very disequilibrium with respect to power relations within a doctor and a patient. A patient, whatever he says, the doctor never listens at times. He will do his own investigation upon them, despite of the fact that he need to understand that what is the pain or what is the experience that the individual is going through. But do they take that into consideration? They just focus upon diagnosing it. Do they ever ask that what is the cultural belief associated with that? Have you ever been to a witch doctor? Have you ever been to a shaman to get yourself cured? People do not tell it, neither they ask it. Okay, if you say the doctor, okay, I have, I believe that this is the medicine I could take, they will clearly say you that you are not the doctor. I am the doctor. I will tell you what to do. So the authoritarian nature they already have in that system. Anthropology can help in equating that from the cultural experiences of people which are out there. That's how you help people in medical sciences, bringing out the data, the cultural beliefs of people, and interpreting them for that purpose. Case of AIDS in Africa, people were reluctant to get tested for that, thinking that it is another form of colonialism, that they will again colonize them. They were reluctant. Anthropologists went, helped out the medical scientists or the medical people to actually understand that what is the belief which is coming out of it. People who are not getting vaccination, they have certain beliefs which are with them. You must have seen in newspaper that when people, these volunteers, when they went to vaccinate people ran away.
COVID vaccine, anti-vaccine.
Yes, people ran away from the groups. People ran away from the centers, ran away from the homes, all of that. So to identify those beliefs, which are the beliefs which are there, we need anthropology for medical sciences. Medical sciences can definitely provide us with anatomical, physiological understandings of how the body works, how the diseases are spread, how the diseases, how to cure that diseases. But certain underlying disorders, which are basically mental disorders, which are culture-specific mental disorders, Kuro, things like that, they will be dealt with anthropological knowledge. That is why medical anthropology is there. Okay, that is one important aspect. See, medical science is not just related to disease, it is more about your physiological as well as anatomical studies of the body. More about disease also, your physiological understanding of the body, your anatomical understanding of the body. These three things are more confined within the medical sciences domain. You go to a medical science, you go to AIIMS, you will find so many departments of obstetrics, pediatrics, gynecology, all of that. What are they related to? In the end, understanding the human physiological and this anatomical functioning, all of that. So anthropology supplements that via measurements. They provide them measurements. Growth. Isn't growth related to medical sciences? Growth, stunting, wasting, isn't all that a part of medical science? That why it is happening? Less intake of proteins, less intake of sufficient calories in the body. And how anthropologists do that? Via measurements, anthropometric measurements. Anthropometric measurements by measuring heights, BMI, what do we say, scaffold length, scaffold, all of these things we measure in that anthropology. So you see, the scope is very big. Medical science, you can say that it might be a sub branch of that, but given the speciality it has, the way it has emerged, it might be different, because you see, medical science has been taking a different trajectory all along. It has evolved in a different way, especially, but during these dark ages, the dissection of body was completely banned, You are not able to dissect body, but with coming of this enlightenment period, then again you are able to dissect body to see how body is functioning, and all those anatomies and physiologies were there. Before that, as I told you, Hippocrates, father of medicine as we call him. Okay, in India we have Charak, father of surgery. Shrut. Charak is also associated with medicine, plastic surgery. Yes, Charak, Shushruk, and Charak is associated with. No, Charak is also an individual, right? Charak is also associated with medicine. Shush. Where do we have his this statue of these people? There is somewhere, right? In UK, maybe. Shushrut or Charak, someone's statue is there in some museum, some library or university. There is, just like Ramanujan's. Which Ramanujan? Not the saint philosopher, the mathematician. And where is statue of equality? Is statue of equality कहाँ पर है? Where is it? There are two statues, right? Statue of Hyderabad. And there are two statues, statue of equity and statue of equality. Yes, in Hyderabad, Ramanujan. Recently, it has been inaugurated. Okay, for like how many years? Like how many years it has been? 1,000 years. Birth sanitary of Saint Ramanujan. And where is that statue of Shankaracharya? Adi Shankaracharya? Kedarnath? There is one in Kedarnath. Yes. You know that? Last year it was inaugurated somewhere. Last year. कौन सा UPSC में आना है? But yes, Ramanujan can be asked, right? They can ask about traditional medicine systems for sure in GS exam. Yeah. It is related to medical science. I was just talking casually, right? This only. So I told you we study growth. Charak was related with Ayurveda. Okay. Charak Sahita. That is the one. Okay, so we know that with medical anthropology we are connecting these disciplines. We know we study growth, disease patterns, anatomy, physiology of the human body, how alternative medical systems are existing and connecting these disciplines. I gave you several examples of AIDS and all of that. What else can be the relation here? Morphology, I have told that how we have talked about anthropometric measurements, malnutrition, and so this is how basically it enhances our understanding, these both disciplines. Format for 10 marks you have to write 150 words with pen. Okay, I'll tell you. See, if the question comes that explain their relationships, first you will tell about that it is more about the relation of physical anthropology with this. More focus is upon physical anthropology, but cultural or social anthropology is also not segregated into that, because we are trying to understand human being as a complete socio-biological agent. One thing. Look at what medical science is all about. Right? It is trying to help us in understanding the physiology, anatomy, growth patterns, and the disease patterns of the human body, enhancing our understanding. So more or less at the upper level, both of disciplines are what they are doing. They are intersecting with each other. They are symbiotic in nature. What they are trying to do is, they are trying to enhance our understanding of human being as a biological being at level of physical anthropology. But the moment social anthropology enters here, it helps in understanding of human being as a complete socio-biological agent. Okay. Now, taking the content of medical sciences, where we have anatomy, physiology, all of that, and taking the content of anthropology, what we devise is medical anthropology. Take the case, these both disciplines married, and medical anthropology is the child of that. Just like psychology and anthropology, we have psychological anthropology. Forensic science and physical anthropology, we have forensic science. So these are the childs of these disciplines, basically, where you have data for both of them. Then give an example that how these are interrelated with each other. Either give of alternate medical systems, either give of certain disorders, that how they help in describing. Take sickle cell as an example, that how this Livingston and Ellison, they have identified how sickle cell anemia is being caused in Africa. Take examples, give alternative medical system example, give any genetic disorder example. So how they both are related to each other, how they are enhancing our understanding. Give example of human genome project. You have 3-4 examples. Give any one example to make the examiner understand that how these are related with each other. Okay. Then ultimately, what do you have to tell? That this relationship between both the disciplines can be thematically studied by considering social, physical as well as the medical aspects of both the disciplines. From anthropology, we have anthropometric measurements which will help in supplementing and understanding the growth patterns, nutritional patterns, because nutrition is also a part of medical life, all of that. Whereas medical sciences can help anthropology in understanding and enhancing that how diseases are being cured. In the end, you are curing the diseases in medical science, na? You are curing the diseases, the kind of medical structures that are emerging. I also give you the doctor-patient relationship example, how power differentials are there, how they can be used to create a more sympathetic space of understanding between the two disciplines, or the doctor and the patients, basically. So basically, when you talk about relationships now, you have to more focus upon defining that how they are related through examples. The moment you grab the example, you will automatically write, okay, this is that how we should know about it. It is through examples you trace out things. So here we have different examples of medicine systems. From medicine systems, what we are talking about, that we need to have cultural beliefs into consideration. One part, doctor-patient relationship. Second thing, power inequalities are there. We need to sort them out. Third thing, study of disorders. That with anthropology, you can trace down through archaeological through this paleopathology, that what has been the disorders which are being coming up in evolutionary paradigms and what is their current stage. Through genetic counseling, you can identify the inheritance patterns. You can help medical sciences in genetic counseling and genetic screening of thalassemia like disorders, sickle cell disorders. This is how you make sense of things into that. Basically, relationship is all about applied dimension of both the disciplines. Here, they are different from your social sciences. Why? Because the content is different. It is more applied in nature. Whereas in sociology, we are studying structure, society, all of that, that is more theoretically oriented. In political science, all of that, it is more theoretical oriented. Here, more emphasis is upon the applied dimension of the disciplines. You cannot segregate the applications for establishing relationships. That is how these things, they work out into that domain. What dissimilarities they have as per you? The biggest is about their evolution, how they have evolved to different disciplines. The kind of practice these disciplines do. One is more into, see, medical science is more confined towards medicinal understanding of the body, whereas anthropology is more concerned about the overall understanding, not just medicinal understanding. What separates anthropology from every discipline is about the holistic nature it has. Not every discipline has the holistic nature which anthropology has. Within medical, How much you will focus on this cultural dimension? Very lesser. Archaeology, very lesser. Yes, you can. See, I have given you good examples. From those examples, just highlight, okay, these are the things, how these are relationships are working, and this is the current state. Give the example of that pig heart transplantation into humans. Keep eyes on these new recent developments. Mention that. They will help you out in the end. For 10 marks, 1 mark will straight away come from these examples, 1 or 2 marks. 2 marks straight away from the examples. They will either ask, explain relationship between them or identify relationship between them. And they can also ask like, what is the role of anthropology in medical sciences, or what role medical sciences play in anthropology? More or less revolve around these things only. They will not ask, okay, critically examine how anthropology is, impacting the life course of medical sciences. They will not ask like that. These questions are basic in nature. Very basic in nature. They will directly ask in that sense only. We need not to delve into deeper, these what we call cardiology, all of that. We need not to delve into that how the muscles of heart are contracting, giving dub sounds, pumping systems and all of that. We need not to dwell into that. We are more focused upon a socio-cultural and a biological understanding of a subject, with a subject which is more confined to the medicinal understanding of the body. That's what we are trying to do here. In social sciences disciplines, our more focus was theoretical in nature, but now here we are more applied in our orientation. Okay, definitions and examples. These two things will create the third base for you, which is about what are the things you can extract from it. Extraction and in the end conclusion. And conclusion should always be about a positive interrelation between these two disciplines because of globalization. Mention that within a more globalized world, disciplines cannot stay in isolation. There have to be a collaborative, interdisciplinary as well as transdisciplinary approach for better understanding of human, biological as well as social systems. Then only we will be able to formulate effective policies. In the end, what is the ultimate aim? To enhance the human health. So we can do that with that. And the child of these disciplines, medical anthropology is the child. Mention about that. So for 10 marks, 150 marks, 150 words, I believe that's more than sufficient for the time being. They will ask either for 10 or 15 marks. Basically for 10. Normally relationship come in 10 marks.
Diplomacy वाला aspect डालने की जरूरत है. In this we can even become, the producer of these particular medicines and we solve diplomacy.
You can?
Not necessarily.
You can write. If you know something, you can definitely write that with more command over one or the other medical system. You can definitely, have, like India is becoming a pharmaceutical giant. It is one of the largest suppliers of pharmaceutical material.
We can form an alliance with African nation.
That can definitely come in this. So it is definitely. What are you doing in the end? You are trying to sort out some pandemics, certain endemics, diseases in the end. They come into the preview of all this. Medicine system is not just about giving you medicine, it is also about epidemiology. Study the prevalence and patterns of diseases. You also take consideration of demographic structures of the population. Corona is a pandemic. That means it has spread to the wider world scale. Sir, there is something called medical sociology? Yes, there is medical sociology exactly within, but we are more confined with medical anthro. Medical sociology is also there. Endemic is confined to a particular place, area, geographical area. What is epidemic? Anyone? What is epidemic? Pandemic is
population that is infected.
It is, no doubt. So we will tell, like,
Because monkeypox has like 15,000 cases all over the world. COVID had the same, but they did not do the endemic pandemic thing in WHO during the February time. That is what is happening.
you know what is endemic, right? That is more confined to a particular area. You know, pandemic, it is more globalized in nature. And what is the third thing which is like epidemic? Pandemic. Pandemic means it's globally. Epidemic is the central one. That's for you to find out. Just place a question mark. Okay, who will tell me what is an epidemic? Sagar will tell what is an epidemic. Akash will also tell. Both of you will tell. So let's first hear from these people and then I'll tell you. Till that time, you also think about that.
Globally. I think 1,000.
Yes, closer. So it's more about case relevancy and case spread, the spread cases. Let's hear from them once. That what is an epidemic?
Monkeypox was endemic.
Hmm.
फिर वो अभी epidemic की stage में आया हुआ, but WHO ने recognize नहीं किया. It's an issue.
Exactly. Epidemic is not confined to a particular group. As they were talking that the cases, when they increase, exactly, Sagar. So when we talk about this endemic, it is more confined to a particular place and population. The moment it spreads out to different population groups, the number of cases they increases to surrounding areas, and the moment it spreads globally, it becomes a pandemic. So it is more like a system theory. Anyone have heard of system theory? It is more like this: endemic, epidemic, and pandemic. System theory. Anyone? Have you heard of system theory? Who is given system theory? Emmanuel Wallerstein. I am talking about development anthropology. Emmanuel Wallerstein has given system theory. Yes, subnational level. From a national to subnational. Just take case of, suppose a disease is, for example, endemic to India. Then when will we say that it has become epidemic? The moment it spread in the Indian subcontinent, Bangladesh, Pakistan, Nepal, Sri Lanka, Afghanistan, all that. And when will we say that it has become pandemic? It has spread across the continents to more number of nations. So that's how the difference lies. So basically, it's more of a systems theory kind of approach, where we have core nations and the periphery nations and the sub-periphery nations. So the core nations, they are like US, Europe. They exploit the nations which are on the periphery for their developmental purposes. They take cheap labor and resources for their own development. So that's in developmental anthropology. This periphery, sub-periphery, core. Just do not write it. I'm just telling you about. So because I don't think developmental anthropology is there. No, it is not. You can write this in globalization and all, no? These theories and all. Okay, clear? So much to write? Okay, then write down for 10 marks, everyone. Leave it. Just write 5 points. No, I don't want lines, just 5 words that will define the relation between medical anthropology and medical sciences. 5 words. Just 5 words, everyone. Identify 5 keywords which define the relationship between these two disciplines. in the system theory analogy, where will public health emergency of no, do not think of public health emergency in systems theory analogy. No, that's not associated with that. If public health emergency of international concern is there, it will be for everyone, even from core nations to the periphery nations. For everyone, it will be the same. Just 5 words which will define the relations. One more minute. Within 3 minutes, you have to write a 10 words, like 10 marks answer, not more than that. And I'm just asking you to write 5 points, not just complete answer. Relation of epidemic. See, if something is of international concern, like it is pandemic in nature, definitely. But more or less, it will be epidemic initially, then it will switch to pandemic. Because endemic are like thalassemia, they are endemic, sickle cells are also endemic in nature at places. They are not of international concern. Human beings, medical health, traditional and modern medicine, okay. 1, 2, 3, 4. Run. Tell me. Okay.
Culture,
Okay.
alternate medicine, disease in check.
Okay. Tell me. Okay. Okay. Transdisciplinary, genetic, other disorders, anthropometric measurements, power relations, value systems. Okay. 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 Interdisciplinary study of disorders, AMS, welfare and globalization. Okay. 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 Mm-hmm. Exactly. Good. नहीं लिखा? चलो 2 बता दो कोई भी, any 2. And okay. ह्यूमन बायोलॉजी रिपीटेड हो गया, 2 बार हो गया ना, 1. ओके, सो गुड गुड मुकुल, गुड सागर, गुड अनन्या. So now moving to the next, which is earth sciences, we will more focus on geology. Okay, so when we talk about earth sciences, we basically study about the nature of the structure of earth, nature of the structure of earth, that how it has been created, what are the constituent elements of earth's crust, mantle, core, atmosphere, everything which is associated with your the nature of nature and structural pattern of earth. How does it help anthropology basically? So what do earth sciences do? They recognize the present features and past evolution of earth they recognize present features and past evolution of earth, and the knowledge which is generated from this recognition, it is exploited by physical anthropologists to identify the evolution of mankind. Once you are aware of how structural patterns of earth they have emerged in different time durations, you can relate the emergence of human beings also with that. Especially there is a branch in geology which is paleontology, which study the past fossil remains and fossil records. Similarly, what do we have in anthropology? Paleoanthropology. We have paleoanthropology. What else we have? Prehistoric archaeology. Don't we have all these branches? And who are called? Tell me. Who are called the historians of anthropology? Who are called historians of anthropology? Anyone? I have told you this. Speak up, come on, they have given the answers. Archaeological anthropologists are the historians of anthropology basically. Okay, they are. Should let us so what do we basically study in geology is the stratigraphy of the earth. Stratigraphy, anyone? The different layers. By analyzing different layers, you create a pattern about the time scale into which that layer came into existence. It is more like establishing certain cultural chronologies, that Paleolithic came first, then Mesolithic, then your Neolithic. So if you are finding something here, you say, for example, it is 2.5 million years of age. Okay, suppose it is 2.5 million years ago. We find bones which are here. We can relate them with Homo habilis, the bones, because they existed during that time period. Suppose then we find some bones here which are like 10,000 years ago. The age is 10,000. They are anatomically modern humans or Homo sapiens sapiens. You can relate with that. you have a complete geological scale, and in which we are at present in the Holocene. Before it was the Pleistocene, because it was the Pleistocene when more changes into the human culture it started coming out, especially in terms of tools and industry in Holocene. And also we also now say that we are in the Anthropocene. So a few years back it was Bruno Latour, the well recognized man, Bruno Latour. So yes, it is more in social domain. So Bruno Latour, he talks about Anthropocene, that we are living in a more, in an Anthropocene world, where we have created so much of ruckus, we have created so much of disorganization in the world, especially for our environment, for our climate, that we have exploited it so much that this whole phase it can be characterized by excessive of human activities.
Anthropogenic domination.
Yes, the domination of anthropogenic activities, basically the domination of exploitative human action. Because in earlier times you have periods of glacial and rainy periods, wet period and dry periods. So the environment it was quite cool, but with in late Pleistocene and early Holocene, you have seen that present age is Holocene basically. It's Holocene. So with coming of Holocene, you will find that the temperature this started coming, it started rising. The glaciers they started melting, and it became possible for man to exploit the natural resources which are available to him. Then only your urban revolution, Neolithic revolutions, all of them, they started in last 10,000 or 12,000 years only, because the environment it became more favorable in nature. Okay. So from geology, what we borrow is dating methods. What are dating methods? Anyone? Huh? Carbon C40. Huh? Tinder wala? I thought Tinder wala. That's also one. Dendrochronology. Dendrochronology. So there are two. One is absolute, and the other is relative. There are chronometric and non-chronometric basically. These are non-chronometric, and this is chronometric. We use dating methods just like in forensics. We use estimation. Here also these are for estimating the time frame for a particular fossil, for a particular artifact, for a particular for a maybe particular tool or anything. In relative you have stratigraphy. So basically the relation between anthropology and geology, it stems from uniformitarianism. The spelling, no. It's TARI. Uniformitarianism, something like that. Uniformitarianism or uniformity. So it was Charles Lyell who gave this principle, or who? R. Huh? And it was given by Lyell, Charles Lyell, or who? नहीं. Just check the name. I forget. Was it Charles Lyell or someone? Huh? George Cuvier. No, no, no. No, this is not the person. No, no. This is not the person we are looking for. No, no, no. This is not the person we are looking for. We are looking for someone else. Just let me see. No, no, no. I'll just let you know. Yes, it's James Hutton. Okay, got it. So Hutton, he says that the Earth, it has gone under certain geomorphological changes during past years, and these changes, they occur due to certain natural processes such as volcanism, earthquakes, more landslides, avalanches, all of that. These natural processes, tectonic activities of destruction and creation, they have brought certain geological changes into the Earth's overall morphological structure.
So rotation and evolution.
So with this began your study of sedimentology, stratigraphy. Okay, all of that. So the relation, it began from this point of time. Darwin also considered this principle when he was formulated his theory of natural selection. So when we are talking about dating methods, we are basically trying to estimate the age of a particular object, fossil record, artifact or tool, and within relative, which are called non-chromatic, you have stratigraphy, where you study different layers of rocks, different layers of soil to identify the age to which it belongs to. You have dendrochronology, where you study tree rings. By counting the number of tree rings, you can identify the age of that tree. You have pollen analysis. Pollen grains, okay, you can relate them from the place where they have been found, the environment in which they have been found, okay, because for a particular place there are some plants which are endemic to that place, so you can identify, okay, this was the plant which was there. That's how they have evolved. Their connection with humans, they might have come from to that place, okay. And what else? These three are basically mains: stratigraphy, dendrochronology, pollen analysis, and you have this volcanic eruption and all. Just tell you. Yes, and you have taphochronology. Taphochronology or your varve analysis, where what you do is you examine the volcanic ash which is there, volcanic sediment, the lava which has been cooled down, okay, because at times when the lava it cools down, it becomes you can identify, it becomes glassy in nature, a bit of glassy in nature. So you do varve analysis, taphochronology from all of that. We need not to explain that, just remember them. Within chronometric, you have C14 carbon dating methods, which are helpful in understanding approximately 5,000, 6,000 years of age. You have potassium argon, K40, argon 40, K39, argon 40 methods. You have uranium analysis, okay, for a longer duration of time to analysis that. Dendrochronology is like you have certain tree rings, if you have seen that, just like this. The Cambrian area, yes? Huh? Yes, if we count the number of rings, and based on that we estimate. Potassium argon method, uranium analysis. This, just remember, these are the isotope number. Leave it. Potassium argon. They have both potassium and argon. They are 40 both. When analysis is done, it's both 40 for them. Carbon 14. These are the examples. You don't have to explore them. Just they are used to date certain fossils, objects, artifacts, and you can create the geological environment in which they have been found out. Okay, that's more for it. Okay. See, uniformitarianism is more about that within the past there has been certain geological changes due to certain natural processes such as volcanism, avalanches, landslides, earthquakes, this tectonic activities. The earth, the structure of earth, it has undergone continuous changes. That is the principle of uniformitarianism all about. Okay. So these methods, they help us in identifying, especially with the help of paleontology, they help us, in identifying the fossil records. They help us to identify the age of a particular product, which is, maybe of human action or may not be of human action. The geological time scale, it provides us the description of how environment has changed with time. Because each of these like Holocene, Pleistocene, all of them, they have their key characteristics, that what kind of environment was there, what kind of flora and fauna was there. Like within Jurassic, you have the dinosaurs coming up, Cambrian, Precambrian, when life emerged, when primates emerged, all of that data is there in the geological scale. Okay, when you trace that. So, especially from geological part, dating methods are important for anthropological perspectives because they help us in identifying fossil records, relating them to certain geological ages. For example, let's take as the case of Raymond Dart. Raymond Dart was a famous, this archaeologist, basically is a fossil hunter kind of person, very famous. He's not exactly paleontologist, basically an archaeologist. So he, in Africa, he said that man is the hunter. Man is the hunter. Man is the hunter. Yes. And he is normally associated with the discovery of Australopithecus africanus. Okay. So he says that the kind of lifestyle Australopithecus africanus have, it makes him the hunter. That is violent in nature. His behavior is more of violent. He is a meat eater. He hunts at a very high scale. He's a good hunter. That is why he's the hunter in the end. But when C.K. Bryan, he did the sediment analysis of the place, he found that it is not exactly the case that Africanus was a very violent hunter. It was the leopards. It was also the leopards which were there. So you cannot completely associate this with him. The violent hunting you cannot directly associate with men, especially with Africanus. It was also the leopards which were there. You need to take them also into consideration. Okay, this is what happened. Then you have the discovery of Homo florensis. Someone is changing my slides. Huh? Huh? The discovery of Homo florensis in 2003. Basically, these are dwarf individuals who were discovered in a pathological condition, that they have a pathological condition with them. that using sediment analysis, C.K. Bryan, modified Raymond Dart's argument that it is not the violent hunting of Africanus, it is about the presence of certain other animals such as leopard, which has contributed into that complete geological environment. So Homo florensis, when discovered in 2003, it was initially thought that this individual has short stature, pathological conditions with that. So a very wide debate was there that where should we actually place that individual, how should we do that. So from geological understandings, initially it was thought that this individual lived around some 12,000 years ago. But by doing some geological understanding, sediment analysis, all of the stratigraphical analysis, the time region, it shifted till 38,000 to 12,000 years ago. So you see how geological understandings, they helped us in doing that. Yes. So using this radiocarbon method, basically radiocarbon and thermoluminescence, using these methods, the date, it was shifted back to 38,000 to 12,000 years ago, 13,000 years ago. Okay. See, it was discovered in 2003. It has certain pathological conditions. There was a debate whether to place them or where to place them in the taxonomic scale. Using these methods, it was found that it was not that it lived 12,000-13,000 years back. It was this duration through which they sustained. So still their classification is debatory in nature, but using these geological methods, we were able to identify or backtrack the time frame of their existence from the fossils which we have. Otherwise, we could have restricted ourselves to this time frame 12,000 years, 13,000 years. Yes, that these methods, how geology helps. The important issue is it helps in defining the tempo of evolution. The tempo of evolution. Write this word. It's important. The tempo of evolution. It helps in understanding the tempo of that. Okay. There are so many more examples, such as existence of Homo habilis, Homo erectus, Leakey, and all these people, Mary Leakey, Louis Leakey, all these people. They thought that habilis, it lived in Africa, and then there is this linear, linear thinking about human evolution, but with geological understandings, it was found that it was not just habilis which was living, it was Homo rudolfensis which was there, and then a distinct form of erectus, it was already existing in simultaneous with Homo habilis and all of that. So these kind of associations, they have been found using geological analysis. Okay, they have been found using such as your this taphonom when we were writing this taphosediment. This what was that? Tapho. Where is it? Where is the slide gone? This taphochronological framework. So through that, we were able to identify them. So more is about this isotopic chemistry, identifying of rocks. I've given you example. You know what geology is all about, how earth structure is all about, crust mantle core. You can relate stratigraphy, you can relate dating methods. Nothing more to relate. It helps in understanding evolutionary paradigms. Creating of cultural chronologies can be done based on these things. Identifying the age of artifacts. All of the things you can write them. Okay, that's simple in that sense. And also when we talk about this earth science, it has certain practical applications such as study of fossil fuels, building bridges, dams, everything you need to have some understanding of the geology in the end. Nuclear reactors, skyscrapers, and all of these, they are concerned with anthropology's global disciplinary relevance. You are creating a dam, you are understanding the geological structures of that place, but While creating the dam, you are also understanding that how it will impact the nearby population groups, sustainable energy source, sustainable development sources, creation of skyscrapers, how will it impact the cultural ecology of that place. So that applied dimensions which comes under your global anthropology. Because geology is not just related to just identifying this. That's paleontology basically. We are more concerned with that. But when it comes to applied dimensions of the subject, they are more about exploring fossil fuels, exploring of fossil fuel skyscrapers, how to maintain that geological structure around it, what should be the appropriate structure, all of that. So that comes into that domain. Okay. Then the last we have is environmental science. Within this, we can talk about something called ecological anthropology. One thing, we can talk about cultural ecology, and we can talk about human adaptation. Can we talk about these three important themes into that? The biggest relation between environmental sciences and anthropology can be seen in discourse on sustainability, because this is something which is, because of which a hefty amount of money is being printed and spread across globe to have sustainability, the discourse of sustainability. Are we moving towards sustainability? That is the question. Are we becoming more sustainable with these sustainable paradigms, or are we exploiting the whole concept of sustainability? That is the thing, na? Are we becoming more sustainable, or are we taking the shield of sustainability to exploit the nature more? Okay.
Your theoretical manner में देखा जाए तो we are P3 protocols सब हो रहा है.
Sir, for global is the name for no. See, when we are talking about global anthropology, I am saying about that anthropology is concerned with different applied dimension of geology. That within global anthropology, you have so many of things which anthropology do in its applied dimension. That it helps people, it helps the displaced people. It helps in policy making. Whenever some dam construction is being there, it helps in social impact assessment, what we call as SIA, social impact assessment. When an airport is being constructed, you identify the geographical area, geological structure of that place, whether it will be able to sustain the landing and uplifting of the flights. So for that you do SIA. So when we talk about global anthropology, so it is basically the applied dimensions of different disciplines where anthropology can situate itself, and it has a role to play. In the end, who is the ultimate beneficiary of all those systems? It is the humans, and to humans we have anthropology to deal with. Okay. Social impact assessment. So the discourse on sustainability is something which becomes very imperative for both of the disciplines. It is, especially after 1990s, 80s, 90s, this discourse has been rising up. For environmental sciences, nature as a concept, it is taken as a face value concept. It is taken in a very light manner. It is their central aspect of study. For anthropologists, nature is a concept. It is socially created. That how do we understand nature around us? Every community have a different understanding of the nature around them. Because every community, they have their own ecological realities. Communities, they have their ecological realities. That how they sustain into that, how they make sense of their communities. Just take the case of Roy Rappaport study, I'll tell you. Rappaport, अरे यार, Roy Rappaport studies. There also Marvin Harris is also there. So Rappaport studied in Sambega community. The role of pigs into that community and its association with the local environment. So you see, these community members, they always kept the population of pigs into control. They never let them out, reach out from the or cross out the threshold level. When the population of pigs, it was in control, what they will do is they will clear out the grass, clear out the the fields these people have, the leftover these people have. They will go and they will clean out that place. Okay, so for a limited number of people, a limited number of pigs were there. So what they will do is they will clear out the space, all those filth and dirt from that place. They will do that. If the number of pigs that crosses the threshold, it will create problem for them, because they will now feed upon the crops they have, they will feed upon the fruits they have, the vegetables they have, and other other eating systems, whatever they have, they will feed upon them, because now we have to sustain a higher population. So what they do is, if the number of pigs, or sorry, in order to keep the number of pigs in check, once in a while, once in a year, they organize a feast for them, where the pigs are eaten. Then in that feast, the pigs are eaten and they are brought into control again. That's how they do, for maintaining the ecological systems around them. That makes sense to them. Similarly, Marvin Harris, he studied the cow complex in India. You have heard this name, Marvin Harris? Cultural materialism, Marvin Harris. He studied the sacred cow complex in India. For him, he says that it is not the ritualistic value of cow or the religious value of cow that it is revered. It is the ecological value of that being which makes the utility of that being very important for the Hindu population group. Harris thought, or Harris perceived, or Harris have this observation that the people who are in the West, especially the US, they think they eat beef in the US. They think that an organism which is consumed in different parts of world, whose meat is considered nutritious at places, why it is being revered so high, why it is being worshipped, despite of the fact it is a delicacy for many. Harris, through his sacred cow complex, tried to find out that answer. He found out that it is not actually the religious value which is associated with that. People have religious value without any doubt, but for Harris it was that the ecological function that cow is serving to them. It is providing them with resources such as milk, cow dung as a fuel. Okay, it helps in it does not grow excessively just like pigs and all other. The lifespan is a bit bigger in that case. And also when it dies, the people who are at the bottom level, at the lower hierarchy, they take up the flesh and then they clean it. They scent it for certain purposes. All of that, that how this whole process works. The skin rearing purposes on all of that. So for him, it is more about the ecological aspect of that rather than the religious or cultural aspect. The cultural ecology, when we talk about, that's how these things come into play, and we need to.
This is also a big pastoral community.
The US is more class stratified. India is more caste stratified. The kind of problems we have are different from them. The heterogeneity we have in our population is different from them.
We can say it's a more of a mythological factor than that, because pastoral communities.
See, this is not what I am saying. This is what Marvin Harris is saying. For people, they do not consciously recognize the environmental ecological aspect of that. Consciously, they recognize the religious aspect of that. Harris conducted the study around 1960s, 70s. 1972 is the paper, I guess, in which it was published. Harris is the authority in anthropological theory as well as in this cultural ecology. So it is very revered concept of Harris. Similarly, there are many sacred cattle complexes there in Africa, which is studied by Evans Pritchard, I guess. So US, you see, it is not more pastoral. It is the highest industrialized nation across the world. If you think that the native Indians, all of them are there, they have also made them to work in these industries only. They cannot sustain without having an interaction between systems core and periphery. So it is more here how much like the amount of GDP it has. India will take forever to catch to that level. It's around 40 trillion, I guess. 20 plus or more than some catching up, and we are at 1 point something. We are 3 in terms of no. There are different types of economy, na? In terms of GDP. No. I'm not asking contribution of agriculture in GDP. I'm just asking the total size. Okay, so this is how they are trying to use, and within these concepts, we are trying to understand how humans adapt to their environment, how environment helps us in adapting to it, what are the resources it is providing. Because you see, Julian Stewart, when he was 22 trillion, like say more or less, yes. So when we are talking about the environment around us, we are 3 in purchasing power parity. In terms of purchasing
power parity, we are more. We top 3. We are 3rd in purchasing power parity.
Yes, Sagar is saying that that we are 3rd in purchasing power parity, but in total number of amount to GDP, we are at 5th or 6th, 6th or 7th, 6th, I guess, behind France. We overtook France, I guess, but we now moved back to. It's more or less. So never mind. Let's improve in that case. Okay. So we need to have an understanding of the nature and culture here, the adaptive processes which we have, the ecological construction of realities, as I have told you in these cases, how ecology shapes environment. So there is a concept of cultural determinism, that how culture determines nature. And there is a concept of technological determination, that how technology determines culture, and there is a concept of environmental determinism, whereas you have that how the nature, it determines culture. Determinism means that one factor is causing an impact on the other. Okay, so within environmental science we have these 3 key issues which we deal with. Ecological anthropology has evolved as a different sub-discipline within social anthropology. Cultural ecology is also a theoretical field within anthropological theories. Human adaptation has both cultural as well as your biological perspective. For example, for higher altitude, the biological adaptations is about enhancement in the number of RBCs by production. Okay, so it enhances the more you have RBCs, the higher the rate will be of oxygen supply. Okay, for cultural patterns, for adaptations, you have different kind of clothings where you adapt into that environment. Okay, and also we have within this something called eco-anthropology. So it is dedicated to large extent just leave it. Eco-anthropology is not our concern as such. Let's talk about something different in this. No, no, not eco-anthropology as such. Also, when we talk about this environment anthropology, we talk about something called ecocide. Side means, yeah, what is this term? Side means killing. Similarly, the killing of environment, ecocide, just like killing of culture, ethnocides. Okay. In contemporary discourse, how anthropology is related to environmental sciences through ecocide. That how environmental, the environment or the nature which is revered in certain communities, it is being killed by the developmental strategies. There has been a case in US where particular indigenous communities, they dragged the US government to court for destroying that. You have heard of this? Atolls? Atolls are there. Adus and atolls. Corals related to that. So those communities in US, they revered these atolls, and when the US did a nuclear bomb testing, they were destroyed. Their sentiments, these atolls were destroyed. The community sentiments which were sacred towards these were hurted. They dragged the government in court and took the compensation for that. So this is more about ecocidal aspects, how things are working in that system. So we need to have a more refined approach to both of these. When you will read with this ecological anthropology and cultural ecology, you will be able to relate how these relationships they are established. Once you will read the applied dimensions or anthropological theories, you will be better able to reconnect all these things. Because here what I am giving you is about a broad introduction at how things are working. But when you will read the theoretical assumptions, you will be able to better relate all these things. Because until unless we do not talk in terms of examples, we will not be able to relate that how these disciplines are working in tandem with each other. Okay, the examples I have given, 2, 3, 4 examples I have given you in that case. So the concept of ecocide is emerging up, sustainable development is emerging up. For example, we also have LP Vidyarthi's concept of sacred complex, nature man spirit complex. All of these examples, how are they related? Through ecological anthropology in the end. Sacred cow complex, sacred cattle complex. And environmental science, it is helping us in understanding the environmental peculiarities which are around us. The biotic and abiotic nature of our surroundings, it is helping us in understanding that. How different these components of environment, they are interacting with each other. Food chain, food webs, aren't they helping us? 10% law. What is 10% law? It's only 10%. Suppose if 1000% is coming from sun, it will be 100% with plants and 10% to humans, 1% with microbes and this and that coming, okay, things like that. So the concepts which are there in environmental sciences, pollution, it is a concept there. Food chains, biomes, niches, successions, all of that, they helps in understanding the local environment of a population, the cultures of the population, how humans with their actions, they have utilized the environment around them. The medicinal properties of certain plants, which are how ethnomedicines, as we talk. And this ethnomedicine concept can be both used in your medical sciences and as well as in environmental sciences also. The kind of livelihoods we attain from environment. A simple example of a discourse of environmental science and anthropology, your Forest Rights Act, FRA. You can situate it in ecological anthropology, environmental sciences and relation with anthropology. How will you do that? It is the populations, the tribal population or the native populations who are dependent upon the forest. They considered it as sacred. They considered it as the mode of their occupation, livelihood. And just in order to conserve forest, you are placing a restriction on their livelihoods. You have to show papers to them, you have to show records to them that yes, you are dependent upon it. So the discourse on sustainability, it has positives as well as negatives. Okay, you are saving the environment, that is good thing, but on the other hand, you are what you are doing? You are leaving people behind in that discourse of sustainability. So when we talk about growth, there are two terms: catch up growth and catch down growth. Neither you are letting them catch up now, neither you are letting them catch down. Somewhere oscillating in between. So humans, they are continuously shaping their environment. When Kroeber says that man created culture with his actions, there are two types of environment which are natural and social. So culture is the social environment. But we cannot neglect the natural environment which is around us, which is impacting our everyday lives. There are plenty of examples. I have given you some anthropological examples into that. Okay, so I think the future is more about this environmental anthropology. So yes, this is that for the relationship part. I hope things are clear in picture. You know examples, how they have to be, because examples, especially in these cases, examples will be a key part. But when you will be reading from your notes, things will become more clear to you that what I was trying to explain. But if still you have any issues, do feel free to ask. And remember that all of these things are inherently connected at a global level. In a more anthropogenic world, as we say. Okay, so try to correlate them. You know what anthropology is all about. Its methods, its holistic approach, comparative approach, everything, field work and all that. Those are the basic themes in anthropology. Just look at the other discipline and see what you can relate, what you can, and disfamiliarize for that. Similarities and dissimilarities, they are very basic things you can do. These are very basic things. The issues come in explaining how they are related through examples, and that I have given you out. Okay. Let's have a voting. Let's vote. Okay, so if you want, I can take on Monday. You say which unit you want to read. Any unit of your interest. Except for kinship. Kinship. Done na? Then good. Basically, we'll try to start this linguistic and religious minorities in India, their political and economic status. It's in paper 2, religious and linguistic minorities. Most likely we'll start with that. If you have not covered that, you have not covered it, right? So linguistic and religious minorities, it's from paper 2. If you want, we can carry on with paper 1 again. Whatever I will be given, I'll teach that. Okay. Sagar, do you want to ask anything? I'm here. The class will get over after that. If you want to ask, feel free to ask. Okay, Sagar, just give me a 1 or 2 minutes. I'll explain you.
आपसे क्वेश्चन आ रहे जो आपने डेटिंग मेथड्स कराए हैं
हेलो सागर, आर यू देयर? मैं मुझे बताना है एक बच्चे को एक बात। हाँ? Tackle your query in a minute. So Sagar, have you seen this slide? Did I explain you about this? Roy Rappaport, Marvin Harris, ecology, culture, ecology, human adaptation. Did I tell you about this? So you have to start from here only. So you see, when we are talking about the relationship between environmental science and anthropology, these three are the key components which we need to focus upon. Ecological anthropology, cultural ecology, and human adaptation, because we are continuously interacting with our environment, and environment in the end shapes how humans and their culture from medicine and livelihoods. Okay, that was in the end, na? Medicine and livelihoods. Okay, so yes, okay, that was in the end part. So we have dealt with environmental determinism, and I was talking about something called ecocide. Basically, that's the last part. Okay, from ecocide, yes. So just like homicide or homicide, side means killing, so killing of humans. Similarly, ecocide means killing of the environment, and due to our certain exploitative actions, we have created a lot of destruction in the environment itself. Just take a simple example of climate change. The temperature has already risen from pre-industrial levels. Just look at the temperature; it has risen around 1.5 or 2 degrees Celsius at least. An example: there was an indigenous community in US who used to rever the atolls. These are atolls, just like these are like corals. Okay, atolls. So the US, when they started, they were testing a nuclear bomb, and these atolls, they were destroyed by that action. The indigenous people, they dragged the US government to the court there, to the highest court there for compensation, because these people, the indigenous people, they have certain sentiments associated with these atolls. So in the end, what that human action did, it did ecocide, means killing of the environment which is there, and we are continuously doing that with our actions, especially in the Anthropocene period. Your Anthropocene is basically characterized by exploitative human activities. It is more human centric. It is human centric. Just like you have periods of Pleistocene, Holocene, all of that, they are characterized by, like Holocene, it is characterized by rising of temperatures. Within Pleistocene, you have more ice, more glaciers into that context. Similarly, in contemporary times, the policies which you are formulating in terms of sustainability, it is not impacting everyone in the same way. The populations which are living on the margins, they are still being exploited by the developed nations. When we talked about core, periphery, and the sub-periphery systems, the core ones are still exploiting them. Take certain cases of when new developmental activities like construction of dams, skyscrapers, malls, everything that is coming up, what it is leading to, it is destroying that ecological sanctity of that place. Okay, so ecocide is a rising concern within the world discourse of anthropology and environmental sciences, that also associates with the power structures across the globe. How power structures are, leading to these ecocides. There's someone who is dominant, They are trying to control the resources from their part. The one who is subordinate to them, they are working as laborers, they are supplying them goods and resources, and who is the ultimate beneficiary, the one who is at the dominant part, and who is the ultimate, the one who gets the ultimate discredit and as well as the disbenefit is the environment. Then, okay, exploiting the same environment for your own use, what we are giving it in result is more pressure, more we are giving it more, we are giving it more pressure, and we are restricting the kind of products it is being produced. New kind of diseases are coming up. Okay, for example, how sickle cell spread, the malaria, how did it spread in Africa with clearing of the grasslands out there. Okay, so this is more about that. This is a more recent concern related with your sustainability purposes and sustainability discourse. Okay, is it clear? I think let him reply. Let's see. Does he say?